All right, Dr. Farrell. So we've talked a lot about advanced biostructural correction here at Align Wellness, where you practice that. But you also have a unique model for health. Could you tell us a little bit about that?
Yeah, so when I was in chiropractic school 20-something years ago, listening to all this information about health, I thought this is really overwhelming. And how can I work on bringing it to a format or a model that is really explainable, really easy? And it took me a really long time, but I finally came to the model that I have now, and the pieces keep fitting in better and better and better. Because my goal or my interest in going to chiropractic school was how to be healthy. I was born with a defective heart valve. My mother had rheumatoid arthritis for 40 years, so she took every drug that she was given, and it did nothing for her physical well-being. She led a terribly uncomfortable physical life, and nobody did anything meaningful for her in terms of helping her. And I think now, knowing what I know, I could have made a much bigger difference. And my father's, well, he turns 99 in a couple months here, and he's been very active and just, he's had his share of health issues. But growing up and seeing all this stuff, I was like, well, how do I be healthy? I don't want to live a life that's not healthy. So how do I put all this information into a model that makes sense? And really happy about 6-7 years ago, working with a couple of friends, we really put it together in the form of this logo. And in the middle here is the light green, and that light green represents your structure. Okay, your physical body. It's like the physical pieces of a car. And if those physical pieces of the car are not bolted together just right, the car's not going to work really well, if at all. Right? If you got a door that's slightly askew, not quite right, well, it'll run, but not nearly as nice as it would otherwise. If you have a tire that's not aligned properly, well, it's going to wear out fast, etc. The same thing for your body. Anything that's not aligned the way it should is going to wear out faster and cause more stress on the body than it needs to. But not just physically, as we said earlier, or not just in terms of motion, movement, in terms of organs, heart, lungs, liver, etc. Big impact. So structure's at the heart of it. We got to get the structure right. And that's where advanced biostructural correction is amazing. From there, we need to condition the body. Okay? How do we use it? Because if I just sit around all day and I don't use my muscles, well, they're not going to be there when I need them. And that's not good. We have to condition our bodies. But we have to do it smartly. There's a lot of programs for exercise out there. Tremendous number. They're all about getting the body stronger. But what are they doing to the structure? Are they breaking down the structure at the price of strength? Or seemingly at strength, because if you actually keep the structure intact when you work out, you're going to actually be stronger with less effort. But they're not. They're not paying attention to what happens to the structure. And because of advanced biostructural correction, it's very easy to understand how to see whether a exercise is breaking down the body or not. The last piece is sustain, right? Structure, condition, sustain. Sustain is what you feed your body, what you eat and drink. Of course, we all know that there are better food choices and worse food choices. Making the food choices is really important because when you're eating well, it's your structure that you're sustaining. The food that you eat is what gives you the molecules to replace your structure on a regular basis, because your tissues are always replacing themselves. Your cells are always changing over with new material. Without good material, the structure is going to break down prematurely. When you get your structure, when you condition it appropriately and you sustain it, you have your best opportunity to reach health. That's our model, and it's really comprehensive. What I really love about this model too is that this I just talked about is the physical side of the model. You could apply the exact same thing to the mental or spiritual aspects of the health, right? How do you structure your mind? How do you structure your spirituality? How do you condition it? What do you do to keep that, working at the forefront of importance to you, right? And then what do you do to sustain that, to feed it? Yeah. So it's a really great model.